China's battle with COVID-19. How has the country responded? What is the latest situation? And what about the economic impact? Hello, I'm Anand Naidu, and this is The Heat. China has made extraordinary progress in battling COVID-19 since the first major outbreak in Wuhan earlier this year. While the disease is largely contained in China, the country is now responding to a minor outbreak in the city of Qingdao in East China's Shandong province. About 9 million residents are being tested after a small number of positive cases were linked to a local hospital. Meanwhile, there's good news for China's economy, with new figures from the IMF projecting growth for 2020. We have a great panel to discuss all of this. Joining me now from Beijing is Einar Tangen. He is a political and economic affairs commentator. With us too via Skype from Shanghai is Dr. Richard Cheng. He has treated COVID-19 patients and is a consultant to Chinese hospitals. Also joining us via Skype is Peter Chen-Hong. He is a professor of medicine and infectious diseases at the University of California, San Francisco. And from Portland, we're joined by Yan Liang. She is a professor of economics at Willamette University. Thank you, everyone, for being with us. Einar Tangen, let me start with you. China has done very well in responding to the COVID-19 pandemic, but we do have this small outbreak right now in the city of Qingdao. Overall, where does the country stand? Is this outbreak largely contained in China?
Well, it's all about measures and the ability to literally just say, within the 3-day period, we're going to test 9 million people. That's incredible. You start looking at that in comparison to any other country in the world at this point, and they're just not those capabilities. One of the reasons that China has been able to open up is these protocols that are in place, which allow it to act extremely rapidly. And this is a very big contrast to what has happened in the U.S., where it seems testing is a dirty word, as are face masks, or I shouldn't say dirty, a political word.
Einar, when you say protocols are in place, what protocols are these?
Well, quite frankly, it's testing and tracing and treatment. What happens as soon as there is any type of outbreak, everybody who's associated with that is quickly notified. They're put immediately into quarantine. And then on a general basis, to make sure, the government will institute testing of everybody in the city, because they do not want this kind of outbreak. I mean, this is the kind of gold standard right now for any country in the world. Just the sheer ability to react as quickly as they are able to, and as I said, on a massive scale, to implement these types of testing.
Dr. Richard Cheng, as Einar said, the fact that China was able to test 9 million people in just a few days, as he pointed out, that's incredible. But why do they test such a huge number of people when there are only just a few number of positive cases?
Yes, thank you for having me on the show. Yeah, as Einar in Beijing pointed out, they do take these issues very seriously. And, as you mentioned, they test a large number of people in Qingdao. Well, they try to catch a few bad guys. Well, I like to add, in addition to what Einar has said, they use a massive tracing technique they call it the green code, basically by the mobile phone, as you know, the GPS positioning. So this is a very powerful recognition or positioning via mobile phone, and they can treat everybody travels around in the country needs to demonstrate on their mobile phone where their whereabouts in at least the last 2 weeks. And they can do these, by the so-called big data IT manipulation. They can identify people who were close to or nearby the outbreak center very, very quickly, and lock their place down. So that's pretty when technologies like this are used in situations like this in the COVID-19 public health issues, they are very powerful, yes.
Right, Dr. Cheng, so China will have tested 9 million people within 5 days in this particular area where there's been the outbreak. What does that level of testing tell us about the country's overall approach to combating the pandemic?
They are all out on preventing and locking down of the suspicious places. There's no question about it. And this is still, it's a trade-off, as we know. If you know, as we have seen, these minor breakouts happened in Beijing earlier, and in some other parts in Harbin a couple of months ago. Now in Qingdao, and it's a trade-off. And I'm glad to say that the minor outbreaks in Beijing will crack down pretty quickly. So whether you have a short lockdown or longer lockdown, the economic impact and the social impact, these are the questions more broader than they're much broader than just a medical question. So to me, these are necessary measures. Yeah, this is as you know, still the top priority of the government nationwide.
All right, let's go to Dr. Peter Chin Hong. Peter, if we look at this mass testing in China, it stands in very stark contrast to what we're seeing here in the United States. And we have talked about this before on the show, about the lack of a national strategy here in the United States. Why has China been so successful when here in the United States, we're actually hearing warnings now that the death toll could be as high as 300 to 400,000 in a very short space of time?
Thanks for having me on again, Anand. I think, again, like you said, it's really the lack of a national strategy. And what our political leaders did early in the pandemic is to relinquish control of many aspects of the disease control to the states. And we all know that state borders are porous. They don't act as autonomous countries. So unless you have disease screening and intelligent border control, you're not going to do anything. And of course, you can't do that in the United States. So you either have a national strategy, and if you don't, then you have the repercussions.
Right, and I guess the other problem, Peter, is that this has become so politicized in the United States that we have different responses and approaches in different states, depending who's the leader of or the governor in each respective state, whether they're Democrat or Republican.
Exactly. You know, right now I'm reading about the big surge in Wisconsin, and to give you some perspective, they are debating whether or not there should be a mask mandate. You know, that's old news from many months ago. That should have been part of their ethos from a long time ago. The very fact that they are talking about it at the state level tells you how far along and how different every state is from each other.
All right, well, let's talk about the economic impact of all of this. And there is some good news. Yang Liang, the IMF has released new figures on Tuesday, forecasting that China's economy will grow by 1.9% this year. This is the only major economy in the world to show growth. Last year, the Chinese economy grew by just over 6%. There's also another bit of good news from the IMF, and they say that the Chinese economy will probably grow by 8.2% next year. The World Bank also issued a similar prediction for China. To what do you attribute these very positive numbers coming out of China?
I think, first of all, as the previous speakers have talked about, that China has taken really draconian measures to contain the virus. So China was the first one to ride out of the pandemic and kept the virus very much under control. And second of all, I think China has had very sound economic fundamentals. Even though the growth has slowed down to 6% last year, it's still a very high growth rate. Not to mention, the Chinese government has launched many stimulus packages, especially in infrastructure spending and also cash incentives to help businesses and consumers. So I think with these very effective policies and with a very sound economic basis, I think it's not surprising that China is going to forge ahead and grow fast. Although I think headwinds still remain. One thing is the rest of the world is still struggling with the pandemic, and also the U.S.-China relationship can continue to worsen. So I think the government needs to still remain vigilant.
Yeah, and Liang, you mentioned consumers there. Of course, China has a big consumer population, but it also depends a lot on consumers in other countries. It's an export-oriented economy. So how much concern is there about the rest of the world, the rest of the world's economies joining China?
Right. So first of all, I think China is clearly now trying to rely more on the domestic consumer base, and I think the consumer spending is ratcheting up as evidenced by the Golden Week in October, where 630 million people are traveling and they are spending a total of $70 billion. So there's a sign that retail sales, for example, has finally increased by 0.5% in August. So all these are positive signs that the Chinese spending, consumer spending is restoring, is recovering. For the rest of the world, yes, China is relying also on exports, but China's imports are also increasing. If you're looking at the September, the most recent data, China's imports actually have grown by 13%, more than the exports growth. So I think, again, this is a positive sign. On the one hand, the consumers are spending again, and on the other hand, China's imports are able to provide a demand boost for the rest of the world, and so that would be very helpful.
Anna Tang, early in the epidemic, of course, Wuhan was the epicenter of the epidemic. It's now been open for months. We see schools have reopened, people have gone back to work, the streets have been open for months. How critical was that early lockdown in controlling the spread of the pandemic when it started out there?
Absolutely crucial. I mean, for some reason, it's not talked about in the world. I constantly see in international press, and they'll talk about Taiwan, all sorts of different places, but rarely is China ever mentioned. But the fact is that China is on course, if this newest projection about American deaths is correct, to literally be 1/100th. That means 1% of the number of deaths in China compared to the United States. That's a frightening idea, especially given the U.S.'s superiority in terms of healthcare apparatus and also sophistication. So, this idea of listening to science, which is taken for granted here in China, was not implemented in the U.S. And you're seeing this really, really stark contrast emerging now, especially when you see these these huge campaign rallies, people, many without masks, no social distancing, in the most critical kind of environment, because when you have people shouting and yelling, they have determined that this is really the worst kind of place for a super spreader event, and it's just not being stopped. I mean, elsewhere in the world, people are scratching their heads, but there's this real sense that the U.S. has not completely understood that until you take care of the actual virus, you can't even begin to count or recover in terms of the economics.
Yeah, it's become very politicized, yeah. Richard Cheng, when it comes to issues like mass testing and tracing as well, I mean, you've got to have an infrastructure in place. How important is China's public healthcare system in combating the pandemic?
Well, actually, the Chinese public health care system has been very good. Actually, for the last 70 years or so, ever since the foundation of the People's Republic. As we all know, back then, 70 years ago, right after or during World War II or before, the infrastructure was pretty poor, and the government has been spending a lot of effort and time and money and manpower in this area. So that's been pretty successful. As we all know, a powerful centralized government can do, when they put their mind and energy into one right justified goal, that can be pretty effective. So there's no question about it. But I'd like to change the topic a little bit. I'd like to mention about my thoughts on the lockdowns. There's always it's a trade-off between the economic, social prices for locking down versus the health issue. My view is that worldwide, I think we all know it's been very chaotic, and the long-term lockdown probably has more economic, social impact than the disease per se. And my view is that COVID-19 is a bad disease, and it's a little bit more serious than flu. However, it's not that bad. All the data came out to point that the COVID-19 is not a disease to be too afraid of. And what we're seeing in the United States is, as part of the problem with the so-called democracy, is that people don't listen. And I'm not sure what the earlier comment was, that the federal government has all the power. I'm not a politician, I'm not an economist, but I do see that the governments at various levels and people, some people don't really pay attention to this. That is a serious problem. I do support the temporary short-term lockdowns, but not long-term.
Right. When you say, Dr. Cheng, that it's not very dangerous, I mean, if we look here in the United States, 216,000 people have already lost their lives. And as I pointed out earlier on, that figure is expected to go up to somewhere between 300,000 and 400,000 in just a few months. So how do you reconcile it not being dangerous when so many people have died?
Yes, sir. That's a great question. That's a very great question. The problem is how you measure the mortality rates. In medicine, in epidemiology, as you know, if you really look at those numbers, I saw analysis earlier that the people who died with only one diagnosis on as COVID-19, actually percentage is very small. I don't remember clearly as early, I just woke up and after a long time badminton game last night. But anyway, I thought it was about 9 or 10% of the total number. However, the vast majority of, unfortunately, those people who unfortunately died have multiple diagnoses. Okay? So as we know, common cold, flu, every year kills many people. It's not necessarily the COVID-19 virus per se. It's often as we know, those people who have underlying immune compromised diseases, long-term lung or heart disease, and if we lump together and contribute to COVID-19. So it's, again, like you said, it's very politicized. So how we look at the number is quite it's game.
Yeah, that's right. People with diabetes and heart conditions, they're more susceptible to the virus than others. Peter Chen-Hong, let's talk about vaccines. That's on the minds of a lot of people. We heard news on Tuesday that Johnson & Johnson has actually stopped, it's paused its testing of vaccines. That's after one of the test candidates got ill. And we heard just a short while ago that Eli Lilly has actually stopped tests on an antibody drug that it was working on. Overall, where do things stand as far as vaccines are concerned?
Well, and I still feel very optimistic about vaccines. We've been making a lot of rapid progress in vaccines, much faster than any other vaccine until now. The fact that people pause or halt trials is actually part of the name of the game in trials. They're just undergoing a lot more scrutiny right now, but I think of it as a good sign because it means that trialists and companies are invested in safety. And I think, to me, it really doesn't dissuade me from being enthusiastic about the progress of vaccines overall.
And Peter, are you hopeful that China would probably have a vaccine soon?
Yeah, I mean, I think the Chinese vaccines are making great progress. Some of them have been published already in publications like The Lancet, and they're using slightly different techniques. Some of them are similar, but some of them are using different strategies. For example, live attenuated virus compared to fragments of RNA, like some of the US vaccines like Moderna. So I think it takes a village, and it's not going to be necessarily one vaccine that's the savior, but a strategy of multiple vaccines, because we need to use as many as possible once they're effective to get as many people vaccinated as soon as possible.
Right. Yan Liang, I want to go back to the economy for a moment. China's foreign trade has registered strong growth for the third quarter. How important is it for the global economy for China to weather the economic fallout from this pandemic?
That's a great question. So as I mentioned earlier, that China's exports have been increasing, partly because China's economy was the first to recover, and so it kind of showed the responsibility of producing a lot of industrial products and also PPE. Very importantly, according to the WTO, China has accounted for about 45% of the total PPE exports in the first half of 2020. And so that means, the recovery of China, the resumption of production is really a bonus for the global economy. Now, China also has increased the imports in the recent months. And so that, like I said, it's also very helpful to provide that demand, which is very necessary for other countries to increase their production. So I think it is important for China to continue to engage internationally to increase trade with other countries.
Anna Tangen, we were talking earlier on about how the pandemic is being discussed here in the United States. It's become a very politicized issue, and there isn't a day that passes that we hear from normally President Trump talking about the China virus, talking about China spreading this, talking about China being responsible for this. He continues to accuse China of being responsible for this. How is China responding to that kind of talk?
Well, I mean, from a popular basis, the public is outraged, and it's cementing a lot of feeling that the U.S. is not the country to follow. For many, many years, people were interested in democracy, the capitalist system, but between the financial meltdown and how COVID-19 has been handled, that has been shaken. There's more confidence in the government itself. So, it's just not gelling very well. I mean, everybody's talking about how there's a negative perception about China among many countries in the world. But the fact is, that is generated by a different process, just simply China growing larger in uncertainty. But for the U.S., this is really, taking down a tremendous number of years of soft power that had evolved. And people, thought of the U.S. in terms of its, being something that they aspired to. I don't think that is true, not only of China, but Europe and the rest of the world. It has been a major turn in terms of perspective.
Dr. Cheng, we of course are now approaching the winter here in the Northern Hemisphere, and it's a time when more people will be indoors, and there is a likelihood that there'll be more infections. That's the risk that could happen in the winter. How well is China prepared for this kind of eventuality?
Well, a lot of publication. Public, encouragement to education is happening, asking people. One thing I like to say during this pandemic that was my extensive involvement with the other doctors working on the front line, including those in Shanghai and Wuhan and other places, is that people do pay more attention to prevention here. For example, the nutrition, and as a paper just published here, just came out in the international journal, that not as part of the story was that the hospital in central Wuhan, all the people, healthcare staff were distributed vitamin C with vitamin C powder. They were taking it, and so this has been a part of the vitamin C and these nutritional support has been a major part of the public preventive measure here in China across the country, actually. And vitamin C and others have been part of the official guidelines in COVID-19 treatment in Shanghai and Guangdong and other places. I'd like to point out about vaccine, if I may. Mm-hmm. Vaccines, of course, we're all hoping, and as actually the only active measure the worldwide has been expecting, particularly the public health officials in the U.S. I like to point out that it's an incomplete measure in dealing with COVID-19. Okay, and we all know about vaccines. Let me just point out that the most commonly used vaccine, the flu vaccine. There's a Cochrane research, Cochrane database research reviewing about 50-some clinical trials about flu vaccines worldwide. The results are actually marginally effective, I like to point out. It's not as effective as people expected the flu vaccines to be. Okay. Now the question here is that how will the COVID-19 vaccines to be? How effective they will be? And as we are all optimistically expecting, but let me just point out the facts. Okay, the problem with the flu vaccine is that the flu virus is mutated very easily.
Yeah.
And in a recent paper in Nature last month in September, is that there have been 12,000 genetic mutations detected in COVID-19. So that is a problem.
Yeah.
And as we expect this, but I'm not so optimistic. Let me put it this way. There will be downsides. Yeah.
Right, Peter, what are your thoughts on that? Is a vaccine just one component of what would be a broader strategy of beating this virus?
Totally, I 100% agree with that. We can't think of the vaccine as a panacea. The vaccine is one of several strategies. And again, we don't know what the efficacy of the vaccine will be, how many people will actually take the vaccine once it's available. Actually, surveys show that only about 50% of Americans right now, given the distrust of the politics around the vaccines, will stick their arm out tomorrow if it were available. So I think there needs to be a lot of work, and I agree that it's a multi-pronged approach, and it's not, a magic bullet.
Right. Yan Liang, before this pandemic outbreak and before the world was swept by this virus, China was involved in some pretty ambitious projects around the world. And one that comes to mind immediately, of course, is the Belt and Road Initiative. Could projects like that be affected in the years to come?
Yes, I think one of the biggest concerns is the debt level of many of the developing countries. They're the BRI partners. So take Africa, for example. I think there's a huge concern about how these countries are battling with the pandemic. They're seeing their slower growth and slower GDP, so they will have difficulties to pay off their debt. And China is one of the biggest creditors to some of these African countries. In 2018, for example, China has lent $150 billion to these countries. Now, these lendings are very useful, very instrumental. For example, in Kenya, they built railroads. In Tanzania, they built ports and special economic zones. I think, if anything, the pandemic shows, how interconnected these countries are and how important the digital infrastructures are. So I think it's important for China to continue to invest. At the same time, I think it's important for China to, take more measured approach to think about that sustainability and the bankable projects and the returns.
I know, very quickly, one final question. I've only got about 30 seconds. We're hearing a new term now, COVID-19 fatigue. We see numbers going up in Europe. We see numbers spiraling in places like Russia. How is Chinese society dealing with the fact that this is a virus, this is a pandemic that's going to be around for quite some time?
Quite frankly, the Chinese believe in results, and what they see the government doing has given them a tremendous amount of confidence. That's why you're getting fatigue in these countries, because in essence, the governments have mishandled the COVID-19, resulting in a loss of confidence in the government, and therefore kind of this idea, throw up your hands, it doesn't matter anymore.
Okay, we have to end it there. Thanks to all of you for being with us, and we need to leave it there. Thanks for joining us on another edition of The Heat.